Hi friends, I'm Abby, a registered nurse here at Blueprint Nursing. If you've seen our videos before, welcome back. If you're new to our YouTube channel, hello. I'm excited you're here and that I get to help you in your journey to becoming a real deal registered nurse. Today I'm going to be reviewing an important topic with you, hemorrhagic stroke. Let's jump right into it. Let's start with the basics. What is a hemorrhagic stroke? It's a type of stroke that occurs from a blood vessel bursting, leading to bleeding, also known as a hemorrhage, in or around the brain. Now that we know what a hemorrhagic stroke is, let's go a little bit deeper into the two subtypes: intracerebral hemorrhagic stroke, or ICH, and subarachnoid hemorrhage, SAH. First is an intracerebral hemorrhagic stroke. This is when bleeding occurs within the brain tissue itself. It is typically caused by high blood pressure. This is the most significant risk factor as it can cause blood vessels to weaken and burst, leading to hemorrhagic strokes. Arteriovenous malformations, or AVMs, head injuries, and blood thinning medications. Symptoms include a sudden headache, weakness, numbness, difficulty speaking, loss of balance or coordination, and decreased consciousness. The second type is a subarachnoid hemorrhage. This occurs in the subarachnoid space, which is between the brain and the surrounding membrane. This is most commonly caused by an aneurysm that has ruptured, but can occur due to a head injury or blood vessel abnormalities. Symptoms include a sudden severe headache, usually described as the worst headache ever experienced, nausea, vomiting, sensitivity to light, neck stiffness, and loss of consciousness. Now let's jump into diagnosis and treatment. When a client with stroke-like symptoms presents to the hospital, the clock starts ticking. The American Heart Association recommends that we move quickly and efficiently with goals of getting clients from the door into a CT scan in 25 minutes or less. When caring for clients experiencing a stroke, every second matters. Urgency and efficiency allows us to quickly diagnose the type of stroke and promptly provide appropriate treatment. We know these clients are experiencing a medical emergency, so immediate treatment is critical. Care provided in the emergency department will focus on controlling the bleeding and decreasing pressure in the brain. Blood pressure medications, as well as anti-seizure medications and blood thinner reversal agents, may be administered. Clients needing surgical treatment may require a craniotomy. This is where a portion of the skull is removed to access and repair the bleeding source. Minimally invasive endovascular procedures, such as coiling or clipping aneurysms, may also be a treatment option. One thing to keep in mind specific to hemorrhagic strokes is that we absolutely must avoid blood thinners. This would of course perpetuate and worsen any bleeding occurring within the stroke, and is the opposite of what we would do in a client experiencing an ischemic stroke. Following proper treatment, clients will likely need rehabilitation. This can include physical therapy to regain strength and coordination, occupational therapy to relearn activities of daily living, speech therapy for any speech and swallowing challenges, and psychological support to work through cognitive and emotional changes that occur as a result of the stroke. The long-term outcome for clients who experience a hemorrhagic stroke can vary widely depending on the location and extent of the bleeding, the client's overall health prior to the stroke, and how quickly treatment is received. Early intervention and rehabilitation are critical for improving outcomes, but recovery can be a long process, with some clients experiencing lasting impairment. So what education should we provide to our clients at risk for hemorrhagic stroke? Education on prevention, you've got it. Prevention includes managing blood pressure, so medication adherence and regular monitoring are important. We want our clients living as healthy of a lifestyle as possible, which includes smoking cessation, limiting alcohol intake, and avoiding drug use. This also includes maintaining a regular exercise routine and a balanced diet. And last but not least, keeping their appointments, especially clients with known risk factors like high blood pressure or a history of aneurysms. We want them to have regular checkups. That's it. Here are our references used for this topic. Thanks so much for reviewing hemorrhagic strokes with me today. If you have any topics you'd like to discuss, leave them in a comment. And don't forget to check out our website for more NCLEX prep resources. See you next time.